We are going to review health, especially since I heard that that's not your favorite. Yeah, okay, thanks guys. For some of you, but I do enjoy it and it's important. So, and I know Nicholas likes it. So, shout out to Nicholas, elbow bump, thank you. And it's a couple others of you that I know enjoy your health information. It's good information. It's necessary. So just be thinking and working carefully. So we're just going to do a review today of the pages before your test tomorrow. So remember, health test is tomorrow, open book test tomorrow, and just be prepared for that. So we're just going to review your quiz. So if you did not do the quiz yet, please don't listen to this because then it won't be fair. And remember, he knows. So be sure that if you have not taken the quiz, that you stop this video now, go take your quiz, and finish that before you finish listening to this. I did grade over the quizzes that came in yesterday. So I was able to grade through those. So hopefully, I don't know if I've returned them or not. So I need to probably return those today, but hopefully you'll see those, see what you missed so that you can be prepared for the test tomorrow. Okay. So section 1 is true or false. If the statement is true, write true. If the statement is false, write false. So it says help that is given immediately after someone has been hurt is called first aid. Oh, yes, that's obvious. Remember we said first aid is the first aid or help that is given. Good. Cavities is a sticky film that forms on your teeth. No, remember, cavities are holes that form in your teeth because of what? I think some of you said it, plaque. Plaque is that sticky film of harmful germs. So that would have been false for number 2. Good. And I think most of you guys got the section 1. Everybody got that, I think. 3, an optometrist is a doctor who examines your eyes. Yes, optics. Optometry. So everything that you think of optic nerve, it's that optic, that is your eyes. So that is true. Plaque is small holes in your teeth caused by sugars and acids in your mouth. No, that would be cavities. So they switched those two around. So hopefully you did get that. That would be false as well. Think that through carefully. Then the second section, which Jackson, thanks for sharing that wonderful with us. I don't know how cough drops in eternal life. I mean, eternal life will be great because then if you're dead, I guess you don't have to worry about your broken bones or your, sprained back or whatever the case may be. But cough drops don't help every single thing. Like I said, my friend, remember I gave you guys the hint where my friend just recently hurt her foot and she rested it. And the doctor said, okay, make sure to put ice on it when you get home. Here's some tape to put on it. Remember, this tape is compression. It helps to compress the area. So you wrap that tape around so that it's nice and tight on that area and it compresses. Compression is when it helps to kind of ease the swelling by putting some of that pressure on there. So compression. So anyway, rest, then ice, then compression. And then he's like, and you just got to keep it up. You can't be on it. You can't have it the weight, the blood rushing down. You have to keep it up so that the blood is not rushing to that area, because when that happens, that causes more swelling. So rest, ice, compression, elevation. Rest, ice, compression, elevation. Jackson, rest, ice, compression, elevation. Rest, ice, compression elevation. That's what rice is. So, and that's an important thing, because if somebody gets hurt that you know, you can say, oh, I know exactly what to do. You need to rest it. You can't use that foot. You need to put some ice on it right now. You don't know what, especially if you haven't gotten to the doctor. That was the one thing. My friend didn't know what had happened, and didn't know if it was broken or sprained or whatever, and hadn't gotten a chance to go to the doctor. But the first thing that she did was to put ice on that, to rest it, to put ice on it, to put it up. She didn't have compression on it because she didn't have anything to do that. But the first thing she did was to get ice on it, to rest it, and to put it up. And that's helpful, because what if you get hurt? What if you sprain something or break something? Before you can even get to the doctors, you need to try this and see if that will help. Then the 3 things that you need to remember in case of an emergency. Most of you got 2 of them. That third one I know I haven't said as much, which I mentioned, so I'm going to review it now. But the first thing you need to do is find a trusted adult, find an adult, find someone to help, okay? Then call 911. And the last thing, remember, we said was to stay calm. Because too many people get on the phone, I need to help, there's something very hard, and the EMT worker, or the I can't even think of, anyway, the operator is going to be saying, hey, so okay, slow down. We can't send an ambulance to you unless we know where you are. Calm down. We need to know where you're calling from, what happened. You have to stay calm. So stay calm, find help, call 911. Stay calm, find help, call 911. Stay calm, find help, call 911. Okay, that's the important things. Okay, Jackson, what is rice? Yes, I knew you would get it. Rest, ice, compression, elevation. Good. And then on the back, some of you missed these. Remember, and I sat there and I had my hands in my mouth for you guys, and I'm showing you. Okay, so I also drew it up here. So instead of even going to your book, I'm going to do it here. I know it doesn't even look anything like the book, but I'm hoping that the way I drew it will help you to see what we have and be able to remember. Oh, it's not really focusing now. Great. Oh, wait. So this first part, if you look, I drew these kind of flat. When you first look at your in your mouth, when you're smiling, here, right there, these first 4 teeth on the top and the bottom. See, you guys have seen my teeth closer than anybody else. Those first 4 teeth on the top and the bottom are your incisors. They cut. Incisors cut. Okay? Then, next to your incisors, there's 1 point. It's just 1 little point. See that right there? On the top and the bottom. It's just 1 point. Right there, 1 point. And that is called your cuspid, because there's 1 cusp. So cuspids are next. Cuspids. 1 point or cusp. And those are right next to your incisors. Then we have these 2 here, and they have 2 points or cusps. So we have our incisors, and then next to our incisors are our cuspids, and then next to our cuspids are our bicuspids. Our bicuspids have 2 points or cusps. So those are bicuspids. Then, obviously, we all got these. Everybody knew your molars, but it was the rest. So it's incisors, cuspids, bicuspids, molars. Same on the bottom. Incisors, cuspids, bicuspids, molars. So the bicuspids have the 2 points or cusps. The cuspids have the 1 point, and they're right next to your incisors. okay? So please look at that little pitiful diagram that I drew for you to recognize those parts of your tooth or your mouth, your teeth, because we did miss that yesterday, and I want to make sure that we won't miss that on the test. All right, so I'm going to quickly try to review, since time is like going very quickly. I'm going to quickly try to review from pages 55 to 78. So what's going to happen is I'm going to ask a question. You're going to have, I'll give you 5 seconds. And if you can answer it before I give you the answer in 5 seconds, you can give yourself a point. And then at the end of all of this, you're going to add up your points and see how many you beat me on, because you have 5 seconds to answer. If you can't answer it in 5 seconds, then I get the point, not you. Okay? All right. So, how should unripe fruit be stored? How should unripe fruit be stored? At room temperature. Did you beat me? All right. Why should ripe fruit be eaten as soon as possible? Why should ripe fruit be eaten as soon as possible? Because it loses vitamins quickly. Ripe fruit will lose vitamins more quickly the more it just sits there. What temperature should the refrigerator be for proper storage? What temperature should the refrigerator be for proper storage? I know you guys got that one before I did. I'm sure most of you. 35 to 40 degrees Fahrenheit. 35 to 40 degrees Fahrenheit. Very good. Keeping foods cold will keep what from happening? When we keep foods cold, what is that? Why do we keep them in the refrigerator? Because what keeps from happening? It keeps germs from multiplying. Keeps germs from multiplying. Very good. All right. Let's see. What vegetables are better for you? Fresh, frozen, or canned? I know you got that one too. Fresh are better. If not fresh, then what's next? Yep. See, it's not so hard to beat me on this, right? Frozen would be the next ones. Good. Where in the refrigerator should you store meat? Where in the refrigerator should you store meats? Okay, good. Either a temperature-controlled meat drawer or the coldest part of the refrigerator, which is usually where? At the back of the refrigerator. Good. Excellent. What should you do with fresh fruits and vegetables? Always, always, always. You should always wash them. Why? It removes the germs and chemicals, very good, that are on those. The longer you store fruits and vegetables, the more what they lose? The more vitamins they lose, very good. Should meats be thawed in the refrigerator or at room temperature? Where do we thaw meats? In the refrigerator, right? Not at room temperature. How long can cooked food stay out of the refrigerator at room temperature? How long? Right. No more than 2 hours. No more than 2 hours. Good. How can sickness be spread? Right. Touching, coughing, sneezing, kissing. All of those things are ways that illnesses can be spread. Also, animal scratches, uncooked or spoiled food, all of that. Let's see. Where do I want to go next? What are the 3 most common areas where germs enter your body? The 3 most common areas. Yep, good. Your nose, your mouth, and breaks in your skin. Your nose, your mouth, and breaks in your skin. How long should you wash your hands? Scrub your hands. I shouldn't even wait for 25 seconds for that. I just said 20 seconds. Good. I shouldn't even wait for 5 seconds for that one because I know you guys know that one well. All right. Then let's see. What helps trap germs when you breathe through your nose? What traps the germs? Right, the hairs and the sticky mucus. Very good. What is the correct way to sneeze and cough? I know, I shouldn't even wait. In your elbow. Very good. How should you treat a headache? Right. Rest, ice, gently massage the area, darker room, take medication from a trusted adult. How should you treat a fever? Take medicine, a slightly warm bath, and apply a cool cloth. When should you get help from a doctor for a fever? We don't want to just go every single time, but when should we get help from a doctor? What temperature? Right at 102 degrees Fahrenheit. Super. Good. I hope you're beating me. How should you treat an earache? Warm cloth and take medicine. How should you treat a stuffy nose? Blow your nose carefully, drink lots of fluids, and breathe a cool mist of some sort. How should you treat a sore throat? Drink warm or cold liquids. That usually helps a sore throat. Breathe that cool mist if you have the little misting machines. Those are great. And now, Jackson, now you can use a cough drop. That will help your sore throat. Not your broken bone, though. What does it mean to identify a type of illness? Identifying a type of illness means to do what? To diagnose. Good. Did you beat me on that one? What are germs that cause illness? Yes, virus and bacteria. Virus and bacteria. What is important to remember when you're taking prescribed medication? Whenever a doctor gives you medication, what do you need to remember? Right. Take only the amount that you're supposed to, and then at the right times, and then finish the whole prescription. Don't stop in between. Oh, I feel better, so I'm going to stop. No, that the doctor gives you the prescription to fully kill all of those germs. They may still be living inside of you for a little while. Even when you feel better, you want to completely get rid of them, so you finish taking that medicine so it kills off those germs. Good. Why shouldn't you oh, we just said that. Never mind. I'm not going to ask that question. Because why shouldn't you stop taking medicine? Because the illness may not be gone completely. There may be more germs that need to be killed. All right. Why should you visit the doctor even when you're feeling fine? Right. He tracks your growth, and it prevents illness because he can check and see, or she can check and see that. Then you had your illnesses and the symptoms. Just know those. It's just an important thing. Where do germs multiply quickly? Where do they multiply quickly? In places that aren't clean, unclean places. Who began the modern nursing profession? I know you know this one. Right, Florence Nightingale. And by the way, there is an Alexander Riddle about her, or Xavier Riddle about her. So if you want to go back and look, I was going to post it, but I might just post it today if I remember. But there is an Xavier Riddle that talks about her and her modern nursing profession. What two things did Florence Nightingale believe helped prevent sickness? What two things did she say could help prevent the sickness that people kept spreading around? cleanliness and fresh air. They didn't realize that back at that time. They weren't really focusing on that. So cleanliness and fresh air. What is personal hygiene? What is personal hygiene? The things that you do to keep your body clean and neat, okay? Those things that you do to keep your body clean and neat. After you play outside, what needs to be washed off of your skin? Your perspiration, your sweat, boys especially, oil and dirt, all of that. Viruses and bacteria are what? Good. They're germs. And then diagnose means to what? Good. Identify a type of illness. So know it both ways. When your parents ask you, have them ask you both ways. What is it? Identifying a type of illness. Okay, what does it mean to what does diagnose mean? So ask it both ways, because you never know on the test or quiz how you're going to see it. So know it very clearly. Florence Nightingale began what? Good. The modern nursing profession. I didn't even wait for 5 seconds. I knew you figured it out. During hot weather, you should take a bath or shower every day. Good. You probably got that one before me too. All right, let me just go down. All right, so with your hair, we know it's not necessary to wash it every day. When you have thinner hair, you do need to wash it more often, but it doesn't have to be every day. Thicker hair, thicker hair you need to wash more often. Does not need to be washed. Oh my goodness. Whew. Thinner hair does, okay. Let's just edit that out, because I'm not restarting this video at this point. And I think I'm going to even probably cut it here, because we did review 68 through 78. But anyway, thinner hair needs to be washed more often. Thicker hair does not need to be washed as often. Okay. What bites and cuts your food? Your incisors. What crushes food? Some of you got where I was going. I tricked you. Not the cuspids, but the bicuspids. They tear and crush your food. What grinds your food? Yeah, that one was an easy one. Your molars. And then what tears? Your coarse fruits and vegetables. Your cuspids. Very good. Sticky film of harmful germs. Good. Plaque. Small holes in your teeth. Good. That's your cavities. How long and how often should you brush your teeth? For 2 minutes, twice a day. 2 minutes, twice a day. All right. I think I'm going to just stop there. Because we talked about some of these with the optometry, and being careful of germs in public and not touching things. A lot of that was on your quiz with your emergencies, Heimlich maneuver. Study all of that over. What do you do for minor injuries? What do you do if it's a more serious injury? You know, get help, stay calm, call 911. All of those things that you talked about. So study over those comprehension checks. Look at those bold print words, those terms to remember, and let me know if you beat me or not with 5 seconds answering some of those questions. I don't think some of you got all of them within 5 seconds. I think some of you sort of have to look them up. So make sure you're being honest, but I hope you did well, and I hope you're ready for that test tomorrow. Make me proud. I'll see you soon.